Hello and welcome to the causes of teeth discoloration. It's natural to wonder why your teeth are stained. Because teeth discoloration can develop gradually, people can often ignore it until they notice it's bad enough to seek treatment. However, knowing the causes of teeth stains is essential not only for treatment but also prevention. For instance, you should avoid the foods that you're suspicious stain your teeth. Then, you can avoid these foods if you think you're likely to consume them in the future. Extrinsic discoloration. There are many causes of extrinsic discoloration of teeth, and the etiology is not well understood. However, experimental studies point to 3 different mechanisms. Extrinsic discoloration is caused by 3 different types of substances: non-enzymatic Browning reactions, Maillard reactions, pigmented metal, Fe, Sn, sulfides, and dietary precipitation. And extrinsic stains develop deeper in the tooth, and are usually indicative of unhealthy habits. One common example is decay, a condition in which the tissue of the tooth dies. It often presents as a grayish-black color, which usually begins at the gum-to-tooth contact. In some severe cases, the entire tooth can discolor, which is known as pulp necrosis. In children, antibiotics such as doxycycline and tetracycline can cause discoloration of still developing teeth. Antipsychotics and antihypertensive drugs can also cause discoloration. Another cause of discoloration is lifestyle. Exposure to certain foods and tobacco products, as well as drinking dark sodas, can lead to discolored teeth. While brushing won't remove these stains, some of these substances can remain on your teeth, causing discoloration. To combat this, it's important to drink lots of water, brush your teeth frequently, and use floss or whitening toothpaste to remove these substances from your teeth. In addition to dietary factors, many people have a genetic predisposition to tooth discoloration. Certain traumatic events can disturb the formation of enamel and lead to white spots on the teeth. Exposure to excess fluoride can also cause teeth discoloration. In addition, trauma to the mouth can result in the death of nerves or reduced blood flow in the tooth, causing discoloration of teeth. Pulp necrosis. If you're wondering why your teeth are discolored, the cause may be pulp necrosis. Pulp necrosis is a condition caused by an inflamed pulp, which has become infected and inflamed. In some cases, it can lead to other serious conditions, such as infection of the bone or soft tissues of the chest. If you suspect that your teeth have been discolored due to this condition, you should see a dentist immediately. A dental checkup and regular cleanings will help keep the problem at bay and prevent its progression. The pain and sensitivity associated with the condition usually subside after treatment. But in severe cases, the symptoms may last for several minutes or even hours. Your dentist will likely recommend removing the dead tissue as soon as possible, especially if you suspect that your tooth has experienced tooth discoloration. Leaving the dead tissue in your mouth may lead to more serious problems, including infections and abscesses. It may even lead to the loss of your tooth. Some people think that discoloration in their teeth means they have a disease such as pulp necrosis. However, this is not always the case. The discoloration of a tooth can also be caused by a fungus, which is not necessarily a sign of a serious condition. Sometimes it can be caused by dental forces, like orthodontic force. However, the discoloration can occur even if your teeth are healthy. If this happens, you may need to undergo an endodontic treatment or a prosthetic procedure. When the pulp dies, it no longer thickens and is replaced by the dentine. This leads to the appearance of the pulp changing from a homogeneous ground glass to a patchy density. You may also see a granuloma, abscess, and apical lucency. Depending on the virulence of the microorganisms, the disease can lead to these problems. Enamel hypoplasia. The most common symptom of this condition is discoloration of the teeth. These spots can be white, brown, or yellow in color. The enamel surface may also have pits or fissures. These areas tend to trap plaque in food. Hypoplasia can be hereditary, but environmental factors can also play a role. It can also cause tooth sensitivity. If you notice any of these signs on your teeth, you should visit your dentist right away. Treatment for enamel hypoplasia depends on the severity of the condition. A mild case may require only special care. Cosmetic adjustments may be necessary to match the discolored teeth. If the condition is severe, however, your child may need fillings, crowns, or sealants. Your dentist will discuss your options with you to determine the best treatment. You should also consider having your child's teeth checked regularly, as early detection may prevent future complications. A treatment for this condition varies from person to person. The earliest treatment is observation. The treatment of this condition may be simple and minimally invasive. If your child is young, a cosmetic material covering unsightly areas may be used. This material should be in a shade of the tooth's natural enamel. Alternatively, your dentist may recommend veneers. Veneers are thin wafers that are bonded to the discolored tooth surface. Treatment for enamel hypoplasia should focus on the causes of discoloration. Several factors can cause hypoplasia. Vitamin deficiencies, malnutrition, smoking, and premature birth can cause this condition. Enamel hypoplasia is usually inherited, but it can also occur as a result of environmental factors. While a child with enamel hypoplasia may need dental treatment, good oral hygiene and regular dental checkups can help the patient manage the condition. Genetic disorders. Inherited genetic disorders are also responsible for discolored teeth. Dentinogenesis imperfecta is one example of an inherited genetic disorder. It causes the tooth enamel to be abnormally thin and yellow or brown in color. In addition to discoloration, patients with this disorder may experience tooth sensitivity, grooving, and fractures. Fortunately, there are treatments for this condition. Until then, here are some things you need to know about genetic disorders and their potential effects on your teeth. The surface layer of your teeth, or enamel, is made up of mineral deposits. Enamel is the hardest mineral substance in the human body. It protects the teeth against tooth decay and can also be a factor in a person's self-esteem. Occasionally, genetic disorders can prevent enamel formation and result in blue-gray, yellow-brown, and translucent teeth. If you're concerned about the discoloration of your teeth, you should see a cosmetic dentist to discuss your options. The best treatment for genetically inherited teeth discoloration is professional teeth bleaching. This treatment is effective and long-lasting, and can provide noticeable results within 2 weeks. While store-bought whiteners may offer temporary solutions, professional teeth bleaching done by a dentist provides the best results. Many dentists also offer take-home whitening products. In extreme cases, tooth restoration is an excellent option for patients with discolored teeth. It not only corrects aesthetic problems, but also gives teeth more stability and resilience. A rare inherited genetic disorder affecting the dentin layer of the tooth is dentinogenesis imperfecta. People with dentinogenesis imperfecta have yellow or blue-gray teeth and sensitivity to cold. They may also have problems with periodontal tissues. The dentist will perform a thorough exam and take X-rays to diagnose the disorder. Moreover, visual examination can be helpful in identifying the underlying condition. Medications. If you suffer from a serious oral health condition, you may be concerned that certain medications could cause teeth discoloration. Some common medications for discoloration include tetracycline, which is a broad-spectrum antibiotic used to treat bacterial infections. However, this medicine may have harmful effects on developing teeth, and young children should not be exposed to it. Other medications for teeth discoloration include antihistamines and antibiotics for high blood pressure. It's best to discuss this potential side effect with a physician before discontinuing any medications. While most medicines do not cause discoloration in healthy adults, some can. Antihistamines, antipsychotics, and antihistamines have all been linked to discolored teeth. This is because many of these drugs inhibit saliva production, which is essential for removing stain-causing debris. While most prescription drugs are safe to take and do not cause permanent damage, some drugs may cause permanent tooth discoloration, which requires professional dental care. Medications for teeth discoloration include certain antibiotics, antihistamines, and other prescription medications. Antibiotics can cause tooth discoloration when taken for a long time. Certain types of antibiotics have side effects, including tooth discoloration. Tetracycline is an antibiotic that is commonly used to treat infections, but can lead to dental problems. This antibiotic is not recommended for women during pregnancy, nursing, or children under certain age. Some people have thicker enamel and more sensitive teeth. Overuse of fluoride can cause discoloration in children, and it can affect adults. Some people also have naturally brighter teeth. Too much fluoride can result in yellow-gray discoloration in adults. To understand more about how tetracyclines can cause tooth discoloration, read Box 7.5. It will help you better understand the different types of medications available for this problem. We hope you enjoyed the video and would like you to like, comment and subscribe to our channel for more reviews every week.